Hi, everyone. I'm Ann Thomas, and welcome to Women Who Lead. On today's Women Who Lead show, we are talking to Dr. Tami Powell. She is the owner of the Oxford Hyperbaric Oxygen Therapy Center. Welcome to the show, Doctor.
Hi, thank you.
I want to talk to you a little bit about this concept. Tell us how you started the center. What's it all about?
6 years ago, I'd never heard of hyperbaric oxygen therapy. And my daughter sadly had an acquired brain injury and was left severely impaired. She was mentally impaired, physically impaired, seizure disorder. She was kind of, as the doctor said, a mess. And basically, we were giving no hope. Take her home, try some therapies, but really there's nothing that could be done. She functioned about an 18-month-old. And we just weren't ready to accept that that's all we had for her life.
Sure.
Being a healthy, normal girl up till 9 years old, and suddenly overnight my daughter's life is taken from her. So I joined some online support groups, and one of the moms from Malaysia sent me an email about hyperbaric oxygen therapy, or HBOT as it's commonly referred to. I had never heard about it, but I knew in my heart I had to try this for my daughter. And so I went online researching hyperbarics and discovered it was very difficult for somebody with brain damage, almost impossible to get. They use it for wound care in all of the hospitals, but in our country we don't use it for children with brain damage. Well, through a unique situation, long story short, my daughter was able to treat in a hospital setting, which is unheard of for a neurological condition. The doctors told me there nothing can be done and assured us that there was no way that she was going to be able to heal from this disability. Well, after a week's time, my daughter was, by Thursday of her first week, she was discharged from OT and speech therapy, no longer needed the services, and after a week she was functioning at a 10-year-old level. So she went from 18-month-old functioning to a 10-year-old in a week's time.
That's amazing.
10 days later, my daughter, who we never expected to walk, was able to stand with support. 2 months later, she was tap dancing and living her life as if this had never happened.
Wow. How was she injured, Tammy?
She had a virus cross the blood-brain barrier and went to her brain.
Unbelievable. Now, how does this work? I have never heard of this therapy before.
It's pretty simple. It's basically you're combining two worlds, 100% oxygen versus our 21% ambient air we have, along with increased atmospheric pressure. We simulate going below sea level, typically about 33 feet below sea level, while you're lying in a chamber. It's a very pleasant experience, although the word chamber doesn't sound like it. You just lie back, watch a movie, and let your body begin to heal. And it just does amazing things. It can, it kills off bacteria and viruses. It increases your stem cells up to 800%. It reduces inflammation, grows new capillaries, improves your immune system, basically allows your body to heal itself.
That's amazing. Now, this therapy is traditionally used for what kind of problems?
Carbon monoxide poisoning. If you're in a house fire, the ambulance would take you right to a hyperbaric chamber. A diabetic Wagner grade 3 foot wound, that's a very deep wound. That's a non-healing wound. Osteoradionecrosis, if you've had radiation damage where your bone and tissue are deteriorating.
Now, you've got more than one center, right? So you decided that you were going to really get involved in this because obviously it changed your family's life. But how did you decide, okay, wow, I want to do this. I need to do something?
Well, after my daughter's life was given back to us, I never wanted another mom to say there's no hope, because there is hope. And I came home and told my husband, I don't know how we're going to do this, but we've got to get trained and we've got to open up a center to give other people the same gift that we got. So we spent a year doing training and getting ourselves prepared to open the center. And as soon as we opened one, oh, what a blessing. We've watched so many families get their children back, or wives get their husbands back after a stroke or after a car accident with a traumatic brain injury. And you watch their lives come back to them. It's such a blessing to be part of. And so then we expanded to offer it to more people by putting centers closer to them.
That's amazing. Now, so you have centers where? Tell us where these are located, Tami.
South Lyon, and then Troy in Michigan, and then Tecumseh, which is a suburb of Windsor in Ontario.
Now, how does this work? Can people get references from a doctor and come to the center, or can they just come to the center out of desperation? I need help. What can you do for me?
They can do both. Pretty much we are patient driven. It seems like when you go into an alternative therapy, which we are considered complementary or alternative, that most of it is patient driven. Patients who are saying, hey, it's not working what I'm doing, and I'm ready to have some true healing. So typically it's patient driven. Sometimes their doctors refer them, but they can absolutely give us a call and come in, and we'll tell them if they're a good candidate. If they're not a candidate, we'll tell them just not a good choice for them. But if they're a good candidate, then it's all they need to do.
And then how can they pay for this? Is this a costly thing for people to do?
Well, I guess that's relative when you say, is it costly?
Well, sure, right. If you're going to have your daughter walk again, people would probably pay just about anything.
Our cost was, if you treat in a hospital, it's about $2,000 a treatment. We knew having to pay that ourselves, that's unreasonable.
Sure.
So we really try to make this affordable. It's $150 a treatment, and sometimes we can get it down to $135 depending on the way you pay. So, a little over $5,000 to treat for 2 months. The treatments are done in a set of 40, 5 times a week for 8 weeks, and the therapy takes about an hour and a half. If you kind of think about what you pay for your cell phone bill, it really is pretty minimal to have your life given back to you.
Now, you've also started a foundation. Talk to us a little bit about the foundation.
Yeah, during our first year, we found that parents of children with autism or cerebral palsy or a brain injury, they were spending everything they had trying to recover their child. And you can recover a child, but it's terribly expensive for the families because it tends to be all alternative that they find the recovery. So we found that our parents were losing their homes and everything they had to recover their children. And so we decided to open a foundation where we donate for or give grants for the children to have access to a multitude of therapies or supplements, anything that's not covered by insurance. Even sometimes the cost, there's a gap between what insurance covers and the rest is private pay, so we can help them even with traditional medicine. But it's a way to make the health care affordable, the recovery affordable to their children. So it's called Oxford Kids Foundation, and we provide funding for children in Michigan to have all sorts of alternative therapies.
Will insurance cover any of the therapy, Dr. Powell?
For hyperbarics, there's like the few that I told you, the carbon monoxide poisoning, radiation damage,
Sure.
Diabetic foot wounds. But when it comes to your neurological conditions, no.
Now, how can people find out more about the Oxford Hyperbaric Oxygen Therapy Centers and also the foundation?
The website's a great source for the clinic. It's oxfordhbot.com for hyperbaric oxygen therapy, and the foundation is oxfordkidsfoundation.org. Now, even though they have the same names, we're two separate entities, and the foundation helps provide funding for all kinds of different kinds of therapies.
I always ask people on this Women Who Lead program, did you see yourself doing something like this when you were younger, when you thought about, hey, what do I want to do when I grow up?
No, I've been a teacher for 28 years. Never would have dreamed doing anything in the healthcare field that I was interested in it, but gosh, I cannot tell you the blessing to be able to do a job that it's not a job, a place to work that you love coming every day, and to be able to give families back their lives. Never dreamed I would be so blessed to be able to do this.
It's such a great story. Thank you so much for taking the time to share it with us.
Oh, my pleasure.
Special thanks to Dr. Tami Powell, the owner of Oxford Hyperbaric Oxygen Therapy Center. And I'm Ann Thomas. You've been listening to Women Who Lead on WJR.com.